Hi, my name's Greg Fell. I'm Director of Public Health in Sheffield. So this is a COVID report dated the 28th of June. It's been a few weeks since I've done one. There's a fresh wave spreading in Sheffield and very more broadly than that. The sort of the BA4 and 5, which are sub-variants of the Omicron variant. The epidemiology is beginning to swing back up. That's pretty clear. Lots of people being reinfected, so people who previously had COVID are being reinfected. Important distinction on cases versus harm. So many people who've been vaccinated are being infected with BA4 and 5, but relatively low rates of very severe illness. The vaccination is doing the job that it was intended to do, and that continues to be the case. Likely be a fairly substantial wave. I don't know how it will play out over the next few months, but there's relatively little in place to stop it, so it's kind of likely to be a fairly substantial wave. It is going to be an issue in the NHS and social care. There are plenty of people who have the illness, and some of them become poorly enough to go and see a doctor, and sadly some of them poorly enough to go to be hospitalised. That will have knock-on consequences to the ability of the health and social care machine to provide care for others. If I had to say three critical messages, one, get vaccinated. There are plenty of people, even people in high risk groups, who haven't had any vaccination yet. There is an evergreen offer. It's never too late to get vaccinated, and that still remains the most important thing that any of us can do to protect ourselves from harm. People worry about waning immunity. Actually, it's holding up pretty well. The protection that the vaccine gives us against severe disease is holding up pretty well, actually. It's very likely that the JCVI will recommend a fourth booster dose for 65 plus and clinically extremely vulnerable. We'll provide more information as soon as we know that, but I think that is on the stock. So if you've had no vaccine, please get some. If you haven't had all the vaccine that you should have had, please get up to date. That's message one. Message two is don't spread your bugs if you've got symptoms. Standard sort of respiratory hygiene, don't spread your bugs to others. Wear a mask. That reduces the spread for people in the household, and especially don't go visiting vulnerable elderly relatives whilst you've got symptoms. That remains pretty critical, actually. And third one, vulnerable people and older people can still order free tests, and there'll be a link at the end. So there's a regular COVID-19 vaccination clinic in Moor Market, stand 81. Clinic starts from Tuesday the 5th of July up to the 29th of September, so open all over the summer and into the autumn. Regular clinic, it's open Tuesdays, Wednesdays and Thursdays from 10 till 3. Anyone aged over 16 is welcome. Remember, fourth booster doses are only open to people aged over 75 and those with an eligibility letter from their doctor. Whilst you're there, you can talk to the community hub staff. They're good folk, can speak a range of languages and help you access all sorts of support around COVID information and local support numbers that remain open. Full details are on our Healthy Sheffield Twitter account. That's at Healthy Chef, as in Sheffield, or the Sheffield Teaching Hospital's Grab a Jab site. And still, a local weekly clinic list is being posted on the main social media channels, so you can choose the most convenient time and place for you. If travelling over the summer, remember a lot of countries require you to be fully vaccinated before you enter, or at least entering those countries is a lot easier if you're fully vaccinated, so bear that in mind if you're planning to visit family or jetting off anywhere for the summer break. A lot of places still require negative tests before you fly as well. So to check the requirements of each country, go to the government's Foreign Office travel advice, which is gov.uk foreign travel advice.